All right.
Okay, so before I enter the patient's room, I'm going to check the door and make sure that there's no contact precautions or anything like that. So it's just standard precautions. I already looked over the patient's chart, so I'm going to go ahead and enter the room. Hello, my name is Mary. I'm going to be doing your head to toe assessment today. Can you go ahead and, I'm going to perform hand hygiene as well. Can you tell me your name and date of birth, please?
It's Greg Winston, June 14th, 1986.
All right, thank you very much. Can you go ahead and tell me what you had for dinner and lunch yesterday?
Some soup and some pizza.
Okay. All right, and so the patient is alert and oriented. Are you in any pain on a scale of 1 to 10, 1 being the least amount of pain, 10 being the worst amount of pain?
6.
6? Okay. Well, I'm going to go ahead and do your head-to-toe assessment. Your skin color is even and warm to touch. I'm going to go ahead and do your neuro exam. So, can you go ahead and just look straight at me? I'm going to check your pupils. All right, the pupils constricted normally. They're about 2 millimeters, so everything looks normal there. Now I'm going to check his sensation. We're going to pretend this is a cotton swab. Can you go ahead and close your eyes, and when you feel the sensation on your face, can you tell me now? Now. Okay. So his motor response is normal. His eyes open spontaneously. His motor response is normal. He's blinking and everything seems to be working okay. I'm going to have him actually take a sip of water to check how he's swallowing. All right, and everything looks normal there. All right, now I'm going to check his upper muscle strength. Can I have you actually grab my 2 fingers and squeeze? All right, so his right and left are about equal. Can you also push against my hands, please? All right, thank you very much. Now I'm going to go ahead and check his lower motor response. Can you go ahead and push against my hands like you're pushing down on a brake? All right, that's good, thank you. All right, now I'm going to go ahead and check his respiratory system. All right. So I'm going to go ahead and listen to your lungs. Have you been having any coughing or anything like that?
Nope.
No? All right. All right, when you feel the stethoscope on you, can you just take a deep breath? All right, can you go ahead and sit up? All right, take a deep breath. All right, take another deep breath. And can you go ahead and deep breathe and cough for me? All right, so there's no mucus or anything coming out of the cough. If there was, I would check and see what color it was, if it had a foul odor or anything like that, but everything sounds normal. I didn't hear any adventitious sounds or crackles or anything like that. Now, if he had an incentive spirometer, I would make sure to teach him on the correct way to use it. All right, now I'm going to listen to your cardiovascular system. All right, I'm going to listen to all areas of the heart. First, I would listen to it with the bell of the stethoscope. Then I would listen, with the diaphragm of the stethoscope, and then the bell. All right, now I'm going to listen to the apex of the heart. All right, the rhythm is regular, and I'm also going to take his radial pulse and check that against the apical pulse and make sure that everything's normal. All right, everything sounds normal there. Now I'm going to check his capillary refill. And it's a normal capillary refill. I would document that. Now I'm going to check down here to make sure there's no edema in his legs. And I would check his tibial pulse and his dorsalis pedis pulse. And everything there is normal. I think that's all for the cardiovascular check. Now I'm going to check the skin. If he had any, I would make sure that everything's even and warm to touch. I would also make sure that there were no lesions, any type of IV. If he did have, we'll pretend he has an IV in his arm right here, so I would check to make sure there was no redness, no erythema, no drainage or anything like that, and everything looks okay there. For the skin, I would check to make sure there's no skin breakdown if he needed assistance with turning or anything like that, but he doesn't. Now I'm going to check your abdomen. I'm going to listen to all 4 quadrants of the abdomen. All right, and everything sounds normal there. Have you had a bowel movement? When was your last bowel movement?
About an hour ago.
Okay, was it normal?
Yep.
All right, so everything was normal there. Everything sounds normal with his abdomen. If he had any drainage or tubes or anything, I would check to make sure that that's okay, that there was no infection or redness around the drainage or tubes and everything. Nothing was kinked or anything like that. Also, I'm going to ask him how you're tolerating your diet that you normally have. Is everything working well?
Yep.
Okay. Also, next I would ask if he's voiding regularly, if there's any foul odor or the color's normal and all that good stuff.
All normal.
All right, thank you. So then I would make sure that the patient is comfortable, and I would make sure that he had the call bell within reach. I would also make sure that the bed was lowered. He doesn't need any assistance. If he did, we would make sure to turn him every 2 hours to make sure that he didn't have any skin breakdown. We would also, if he needed assistance to a chair, we would give him assistance to the chair. We would also make sure that the side rails were up, the call bell was in reach, and that he was in a safe environment. And he is in a supine position. I would probably leave him in the Fowler's position just for comfort and so he can watch TV. And I believe that's it. And that would be a head-to-toe assessment.